Hi, and welcome to SpondyCast, where we bring together the best medical minds, thought leaders, scientists, patients, and caregivers to inform and inspire the spondylitis community. I'm your host, Jill Miller, living my best spa life, knowing that how we meet today has the power to change everything going forward. Please note that the information provided in this podcast should not be considered medical advice. We do encourage all listeners to consult their healthcare professionals for medical concerns. Thank you for listening, and we hope you find our discussion today enlightening. Hi, and welcome to SpondyCast. In this episode today, we're joined by Susan Murphy, Doctor of Science and Registered Occupational Therapist, to introduce the new SAA-funded RENEW Study. This is a University of Michigan research initiative focused on fatigue, energy management, and resilience in people living with spondyloarthritis. Dr. Murphy discusses why fatigue remains such a significant unmet need, how patient input helped shape the design of the RENEW study, and what the research team hopes to learn as recruitment begins. Listeners will get a clear understanding of how energy management and resilience can be supported in everyday life, what participation in the study involves, where they can find out more information, and why research like this is critical to improving day-to-day quality of life for people living with spondyloarthritis. Our guest, Dr. Susan Murphy, is a professor in the Department of Physical Medicine and Rehabilitation and Internal Medicine Rheumatology Division at the University of Michigan. Dr. Murphy's research focuses on developing and implementing chronic symptom management interventions using behavioral and rehabilitation approaches to support holistic clinical management. She has a particular interest in advancing telerehab and mobile health interventions and directs the Telehealth and Rehabilitation Advancing Chronic Condition Research Center, or TRAC, at the University of Michigan. Her work focuses on community-engaged research, partnering with individuals who have autoimmune diseases like scleroderma and now spondyloarthritis. Susan, welcome to SpondyCast.
Thanks for having me, Jill.
I'm excited to have you. This Renew project is something that is near and dear, and I think is going to be really valuable within the community for our listeners and broader community with people with SPA. So we want to start getting to know you. Can you tell us a little bit about yourself and what your role is in the study?
Sure. I'm a professor in the physical medicine and rehabilitation department at University of Michigan, and also in the rheumatology division at University of Michigan. And as you said, I lead a center that is really focused on chronic condition management and what people can do to actually help their symptoms. So it's really focused on the holistic component of chronic condition management and rounding out things that are advanced in clinical care but don't have a lot of time for focusing on things, just day-to-day life management of symptoms. I led a team that developed the RENEW intervention, and working in this project with Yen Chen, who is a research assistant professor, also in physical medicine rehabilitation. And we also work in the scleroderma program primarily, which is how we got to know people with lots of other rheumatological conditions and realize that there's a lot of benefits to the approach that we're doing, not just for scleroderma, but for other people, like people with spondy.
Yeah, for sure. It is fatigue and energy management is definitely top of the list. So overall in your journey, what started you down the road with the RENEW study in terms of like what was the key research question you were after?
Yeah, I guess I'll just back up and give you context that kind of led us here, because it was really for me a 20-year journey to get to RENEW. And it started out with trying to help people manage their symptoms in osteoarthritis and finding out the approach that we were using, which is very similar to how many approaches are done with chronic condition management, where you have people like white coated doctor people telling you you need to be more physically active and you should sleep better and you should eat better, but not giving people very concrete strategies that are relevant and useful to them. And so I started off in this kind of self-management journey in understanding that patients need to be much more engaged in this process to help others. And that's also what patients want to see. So um, through many years, the RENEW program started to develop probably about 7 years ago, where we really started to pilot this and work with patient partners. We wanted to see if this approach that we have that has peer health coaches that guide how people are doing, practicing healthy behaviors for self-management, if this would help people reduce their fatigue and also some of the associated things that arise with fatigue or are associated with them, like pain and depressive symptoms and sleep quality. And also, if they feel more resilient, that if they feel like they're better equipped to deal with struggles in daily life. Because really, the other component of Renew that was a little bit of an evolution for us was this focus on positive psychology and not making it such an obligatory task that you have to do. But, part of what Renew does is practicing positive strategies, relaxation, pleasurable activity scheduling. So there's a lot of things that are focused on your mental health and not just thinking about disease and physical limitations, but really just living life in a way that's more holistic. And I think people are much more engaged in that kind of strategy than one that just feels like another thing that your doctor told you to do.
Right. And I've sort of been watching the work you did in Renew around scleroderma, and a lot of we came together through Afton Hassett, who I'm just a huge fangirl. She's like my hero. And it as I came through this, it really you start to learn about, and I haven't done the Renew program, but in general, a lot of the focused work on pain management and fatigue management at Michigan is really like that. Resilience is that word that sits at the center of all of it. And I think a lot of people I know are surprised often to hear that your daily living and routine can provide relief, whether
Yeah.
it's spending the 7 or 8 minutes in the morning stretching, or because then some of us get to 2 hours of stretching and it still doesn't help for the first month. So I think it's really exciting, and fatigue is something that is, I think, often overlooked and sometimes dismissed, right? For people with chronic diseases. And I know, having experienced it personally, and I know a lot of people who do, like, why is it so overlooked for people in the pain realm?
Yeah, well, I think we looked at this kind of in the literature and talked to a lot of patients about it. And fatigue is one of the worst symptoms that people have that they don't tell their doctor about. Um, and some reasons for not talking to their doctor is they feel like, oh, we have to get through all the other things that are more important, you know,
Mhm.
what the medication changes and the disease activity and all of that. And also, they don't believe, and some of this is anecdotal, but patients don't believe that the doctors have, treatments for it. And then when I talk to rheumatologists, they're like, yeah, we don't have treatments for it. So, kind of on both sides, like people are kind of acknowledging. And the
Yeah.
reason why is that it's so multifaceted. There's so many contributors to fatigue, and one person's fatigue may be very different than another person's fatigue because there are lots of reasons. There are disease reasons for fatigue sometimes. If your thyroid is out of whack or you're anemic or something, and a doctor can look at your blood work and say, like, oh, we can fix that, and that could help your fatigue. But because fatigue is also, there's mental contributors and emotional contributors and pain contributors and stress, external factors. There's so many contributors that it's really hard to say, like, take this pill and you're going to have no fatigue. It's something that requires a multi-pronged approach.
Right. And the best description I ever heard of it, there's a researcher out of Europe, Dr. Cordy, and he's done a lot of AXPA fatigue research. And when he described fatigue to me, I actually like burst into tears because it was the first time anyone ever like acknowledged and described like what I think I feel. Uh, and this idea that it's fatigue is often also like the back end of something that happened a long time ago, right? It's the effect of, like you said, anemia or different stressors or social pain. It's a lot. Uh, so as you designed, I want to touch just for a second on the RENEW study and the results you had in scleroderma, because I feel like uh, we're going to see positive results. But I'm curious, like the success side of the beginning, and then I know the team working on this project has transitioned and really like dug in a lot on the expertise for people with axSpA and how to adapt it. So, can you tell me a little bit about the success side of the scleroderma?
Yeah, I have to say it's probably the most rewarding thing I've ever done in my whole life. Like, because it's the people that we get to work with to develop something that is a meaningful process and approach has been incredible. Really, like, researchers can come at Renew and, throw all the evidence base at it and like, here's what you need to do and here's how you should be doing it. But like, it was the patient advocates that rose up that made it successful. And it was those people that helped shape what the peer health coaching looked like, um, how to interface with people in a meaningful way. And they already had a lot of experience. So, um, just foundationally at the University of Michigan, we have one of the largest peer mentor programs in the nation. There's over like 30 different peer mentor programs that are nested in clinics. So, for different conditions like cardiac rehab or pulmonary hypertension or scoliosis or a spinal cord injury, like any kind of condition, there's peer mentor support that's built in. And so we have a lot of people that can kind of rise up and do this coaching piece, which requires training and you have to do things in kind of a standardized way, even though it's a tailored conversation with each person based on their own issues that they're talking about or what goals they want to set. There is some skill that needs to be taught or fostered with peer health coaches. And using this approach, the success of the program itself, we conducted a large clinical trial. It had 173 people in it from 7 countries. Because it is all remote, we could have people participate from anywhere, which was actually really interesting for us to see differences across country in the care they receive and the resources and the knowledge that they have. But even with all of that variability, we found that people had clinically significant improvements in fatigue, which is, we use standardized scales and it's, about 3 points on a scale, which doesn't really mean that much to people, but just fatigue. We had a huge effect on fatigue, but also other things like interference of pain in daily life. People improved quite a bit on that. Their depressive symptoms that they have throughout a day improved a lot, and their resilience went up quite a bit. And we found that when we look at like what are the change agents in interventions, like resilience is the thing that really causes improvement. So people that become more resilient are actually able to better manage their symptoms.
Can you tease into resilience and like how you define that?
We do use a validated scale, and it's the Connor Davidson 10-item scale that it asks about kind of your flexibility and adaptability to deal with struggles in daily life. So your ability to bounce back from things, you know, and there's probably just a lot of ways that they say that in these 10
Yeah.
items, but it's basically kind of about your mental fortitude of like, can you get back on the horse? Can you can you come back from this? How are you adapting to these things that come at you in everyday life?
Yeah. And I think it's something that I never really thought much about until probably I had expo. Uh, you just get up and you keep moving and going, and as you learn, there's probably I probably know a lot less now that I've learned more, but I think for patients too with this, and in general, I started learning about resilience, and I think the word adaptability is like really the key there is like something goes sideways or just a general day and being able to get up the next morning and keep stepping forward and when things go sideways, yeah, I think that adaptability piece is something we don't think about that often, and it's hugely important, I think, as you journey across a chronic illness.
Yeah, I agree. And I think that's one of the things that's nice about Renew is that there is sort of a community element to it. I think that knowing that you're not alone and that there is someone, you can talk to and get, coaching from, and there's other people with this condition. Um, axpa is a little less rare than scleroderma, but you're still kind of in a group where not everyone has axpa, not everyone has these diseases, where that it's kind of nice to see like, oh, that person that I'm seeing represented, on this website or in an app, like they're out, they're out hiking, or they're out, doing something active, or, look at them meeting someone for coffee. Like it just, shows you that you're in a community. And I think that, I mean, this is just my hypothesis, but I think that is one of the factors that increases resilience, is just that you're not shouldering these huge things by yourself. Like there's other people out there, and there's people you can reach out to.
Yeah, I think that's huge. And we should maybe back up because I'm super excited about this because this is a piece of research where patients get to actively participate, get a benefit, uh, and of course, I'll plug that we were able to fund this at SAA, so that's really exciting. And that is, but we talk about research a lot, especially in the last 14, 16 months, and it's so critical that we keep funding things that move the ball forward for people with these disease, with our disease and our family of diseases. Uh, so with this, tell me a little bit about how it will work. We want to use some of this today to like recruit patients. So let's talk about how it's going to work a bit and the the process.
Yeah. So just to give you a little bit of thoughts about how Renew was originally built, we have sort of a foundation of materials that are designed to help people with sort of the medical, like acknowledging sort of the conditions that people like with scleroderma had. And that was all kind of, here's the educational content, and here's how we would tell someone to do certain health behaviors. But what we needed patients for at that point, and I'll relate it to axpa in a second, but like the patients that we engaged at several points was to look at the material that we had established, and to see what was missing in terms of like what they would want to see. like what they would want, like the patient-facing material. So for scleroderma, we engaged people to look at it, to give us their thoughts, to help us do some revision of the educational material. And then we had patients that would help with quotes, anecdotes about things, provide pictures, like make it look like it's the community of people that you are trying to engage with. So we have this all fleshed out for scleroderma, but then we looked at it. We've been starting to look at it with our key partners, many who are at the SAA and rheumatologists and specialists to make sure that we're tailoring our messages appropriately for AXPA. In terms of, how do you do things with pain? How does stiffness play in, in ways that, we want to tailor it to things that people are experiencing that would be different than scleroderma. But knowing that our overall message of being more physically active or eating in a healthy way or sleeping well, a lot of those key messages are not going to change. But what changes is some of how people experience symptoms and how people are doing strategies that are successful. Those things look a little bit different. So we have an initial draft of what we have taken from Renew. We have worked with our initial more medical group to get what we think is right from a physical therapist perspective, a rheumatologist perspective, people that help patients with management on a clinical plane. But now what we're doing next is we're going to have people that will come and do focus groups with us. And that's one of the things that we're trying to recruit for, is that we need about 32 people with AXPA to participate in virtual focus groups. So everything is all remote, and it's really just dialing on and having looked at the material that we sent, and also kind of in the group, asked some questions about the material and what they liked and didn't like, what's missing, what would help them. And then we directly use that feedback to make it better. So we are making it in the way that we think people want it, and we are using these small groups to help us figure out what people want,
so that it works for the spondyloarthritis community. That's awesome.
We pay people, I should say, to plug. They get $25 for participating in the folks group, which is, I know, not much, but just to just say that we really value your time and we really use feedback that's given, and figure out how we can integrate it and best. So we really appreciate this is part of our research to do these steps, and part of what we got funded to do. We are compensating people. It's like about an hour and a half of time.
So an hour of time, you get paid a little bit, and you get to guide what can be a real tool for people to feel better in the long run.
Yeah. And then once we get it all refined, then we're going to do a pilot study in which people will actually practice with a health coach and actually go through the Renew program, and again, give us their feedback. So we'll measure outcomes and things for that second phase. There's about 40 people that we need for the second phase after we get everything refined. But it's mostly to look at the feasibility of it. Do people like the content? Again, it's really trying to test out how people feel the process is, and some of the content and the experience of Pure Health coaching. We don't want to make assumptions that just because it went really well for people with scleroderma or in a certain way that it's going to function in the same exact way in another group. And we just want to be really careful that we're making it how it should be for AXPA.
Yeah, for sure. And I think there's a lot of magic in that if we get it right.
Yeah, I definitely think there is magic, and I also think that what we're doing to me seems so common sense because it's using people's expertise. It's acknowledging that everyone has different expertise, and it's bringing the right people to the table to do the right thing. And that's what I feel like is missing from a lot of these management interventions. Typically they come from this just researcher perspective who, you know, may know the patient population, but not know the lived experience of that, and how that lived experience shapes how you talk to people, what information you put in front of them, and how. And that's what the patient partners have been just so extremely important to help us get right.
Yeah, and once you get through the first phase and into the second phase, how long of a program is it intended to be?
It's a 12-week program, and it involves 9 sessions with a health coach. That's about 15 to 30 minutes a piece. So typically people that we're randomizing, so not everyone gets Renew. We have also a control group just because it gives us more information. But people that are in the control group that don't get Renew, they will get it at the end. Like they'll get all the materials, and so they have kind of a version of the whole program. But the people that are randomized to Renew with the peer health coach, the 9 sessions, they basically do goal setting with the health coach, where the health coach is trained in what we call motivational interviewing, which is really an approach, if you just distill it down to the very bare bones, is like the peer health coach is not making assumptions of how you should do something, like, or what you should do. Like, it's a very question based process where they're trying to figure out, like, well, what do you want to work on? And like, you know, for physical activity, which is our most common thing that we start with, you know, not everyone wants to run a marathon or to do some feat that would, like, one person's, you know, 3-mile walk could be another person's walk to the mailbox, you know? So like, it's really getting at where is a good place to start? What do you want to work on? What things make you excited to try? And the health coach also helps people try as many things that they can do in terms of, we have these different educational modules. We have like seven modules with all these different topics, and they each have built-in homework, not really homework, activities that you can do that can be your goals. But not everyone wants to do everything the way that it's written. Maybe they want to stick with physical activity and not try as many of the others. And there's a lot of tailoring that can happen in the program, and the coach just helps someone through that for themselves. Because really the goal is for someone to be very aware of their own symptoms and how they change over time. That's one of the key pieces of management, is really trying to figure out what makes my fatigue worse. Is it at certain times of the day? What things have I been doing, or what things have been happening that has made this a more compounded experience? These kinds of things can really kind of be the building blocks for how to manage it. So trying to, like, we got back. Sorry, like, what was your question? Because now I'm just talking.
No, that's okay. Well, we were talking about I'm fascinated, so don't worry, you can talk all day. I was just talking about, as they move through that it's 12 weeks of participation, and it's combined with a little bit of technology, so they log on, can work on the modules or read the modules, and then they spend 15 or 30 minutes with a peer health coach throughout that 12 weeks, really sort of taking them on the journey.
Yes, exactly. And it's a website right now. In future iterations, if we can do a big trial in AXPA, we'll probably do what we do in scleroderma. We have an app where people can track on the app and things like that. This is really just to get all of our content right and the health coaching established and all of that. So again, we're in kind of the building stages. where we hope, that patients with AXPA will really contribute to the process and help us create something great that we can then test in a large study.
Yeah, and within the building out the materials and understanding this from a pilot perspective, I'm curious, peer coaching is something I think that's growing out in the world. You mentioned there's 20 programs at Michigan?
30.
30. That's a lot.
Yeah.
So do you have a general sense of the difference between, because there are coaching apps and, everywhere you go, there's like a nutrition app or there's this app. And having tried a couple of them, I found that the people on the other side were very much like boilerplate, just go do this. And we're all very different, but I think what success do you see with these tailored programs and approaches as opposed to uh, just general nutrition or general movement?
Yeah, I feel very strongly that peer health coaching is the way to go for many of these, for what we're trying to do. And I guess for me that came out of, I have a whole nother line of research where I work with community health workers, and we develop trainings for them to go in to do research studies with just people in communities, and seeing just the tools that people naturally have as peers, and the ability to not only speak to people on a level that makes sense, but also that they can build trust very quickly. They just have this shared understanding, and whether it's someone in an underserved community versus like someone who shares some sort of experience with you. It's sort of the same to me, where I think that is what makes coaching like a much richer experience when you're already where you're already kind of on the same plane, with someone that you share this lived experience, even if it looks different, or you still know what it's like to live with chronic pain or live with chronic fatigue, and have to explain to others what is going on with you. And like there's so many ways that people connect, that that's actually what we're trying to do at the University of Michigan, is to try to build a peer health coaching wing to their peer mentor program, because it's just another way that you can help people, not just to cope with like a new diagnosis, but then like, now what? Like, now
Right.
I'm just living my life. How do I do that, successfully? So I agree with you. Like, the health coaching, it's a field that people go into, and we've looked into many ways of how we can sustain peer health coaching. And one way is that people get national board certified to be a health coach, and it takes many, many hours, and you have to. It probably totals maybe 200 hours of things that you have to do,
Wow.
and it doesn't seem like that's a great route for peer health coaches. Like, the reason why people get board certified is that they can get reimbursed for it. So a lot of the health coaches that people would go sign up, to take, you either pay out of pocket or you can get some sort of insurance can reimburse or whatever. But for peer health coaching, we need to find a mechanism to sustain it, and keep people trained up, and maintain them. So it's not like the easiest issue. In fact, our patient partners at scleroderma program, and us, are in the process of setting up a nonprofit, to try to find ways to fund this kind of ongoing service, because we think it's that valuable. But I do think that it's worth it. I think it is a better coaching experience. Um, that's, again, I'm doing a lot of this from my own lens and from what I hear from people out of scleroderma. Um, but I think that if you have a certain number of hours with a health coach, you want that health coach to be the most fantastic health coach that you can
Right.
find.
Right.
And someone that's trained but have lived experience, I think, is a great combination of skills.
Yeah, I think it's also, and you hit on something, right, that people when they go into the field and they go after uh, a certification, it opens the door for them to be able to be reimbursed, and there's so much red tape, I guess, associated with it. And I often think of all the things that over the last 12 years I personally have invested in, whether it's Ayurveda, uh, personal training, and things that like I've been able to. And at times, I've also found there's 1,000 things we can do that cost nothing. Uh, but at the end of the day, it often comes down to the dollars that insurance will pay. Uh, and that's very unfortunate because to your point, and it's, I think, widely this idea of peer coaching, lived experience, and a sort of this community setting. A few years ago, I went through, I became a certified tobacco treatment specialist. Uh, I felt strongly that that was something that's really important, and had the privilege of going through Mayo's program and administering that. But like one of the evidence-based pieces is you can put people on a medication all day long. It doesn't mean it often doesn't result in long-term cessation. And I think this is along the same lines that, just giving people sort of a scaffolding to hang on to as they go through, because it can be bumpy, right? It's you start a program, you increase physical activity, all of a sudden the fatigue goes like this for a couple of weeks.
Right.
And
Yeah.
having been through when you literally, like, I think of it there, and there are days I'm sure people listening have had them, uh, when you cannot drag yourself out of bed despite the fact that you know where you need to head next. And and it comes back slowly but surely when you go through these events. And that's where I love the resilience piece, uh, and being able to really understand and feel. I get very emotional when I think about fatigue because it is uh, it's so overwhelming, and it does have impact across, your ability to think at work, your ability to spend time with your kids. And one thing we didn't talk about, and there's the spoon theory. Have you ever heard of
Oh
this?
yeah, everybody loves the spoon theory.
Yeah, and I can remember trying to like educate my kids on this when they were like in kindergarten. Like, well, I only have this many spoons today, so we have to put them, we have to put off whatever we were doing. And from there, I moved through a lot of the pieces, and there's peaks and valleys, and I think there is for all of us. Um, but yeah, being able to share that with people more broadly is like huge. And I love the idea of how do you bring that to more people through either a nonprofit model or a simple, like a scalable model that really drives change. And yeah, I love that idea. Okay, so keep me posted on the spondylitis one. um, okay, so before I know we're coming to the end of our time together, let's talk about where people can find out about next steps if they would like to participate.
Yes. So we have, I'm not sure how the best way to share it because we have like links that people can click on. We have QR codes that we can share. So maybe as part of the podcast, if they could, see our little infographic type thing, if people are interested, like we'd love people to sign up. And as people sign up and do stuff with us, if they want to keep being engaged, that we typically do ask them other things if they if they would want to do it. That's but basically how we'd start is the phase one of this is that we just need people to look at the content that we have. We're missing a lot of patient-facing stuff at this point because we don't directly work with a lot of people that can give us, things that they would be okay with sharing. So we do have people that would, after looking at things, and if they are like, oh, it would be so nice to see this, like a person that's being active here, and they wanted to give us a photo of them, we would have them sign a release and stuff. But basically, I'm saying all this because people can be involved a little bit or more in this whole process, and we invite it for people that are interested, that want to help us with kind of fleshing out some of this stuff for expo. Or if they just want to be in a group and give us their thoughts and that's the end, that's great. And then if they want to also be part of phase two, we would keep kind of a running list of people. So really it's just kind of clicking on our QR codes and links, and we can get in touch with you as we get rolling here.
Awesome. And we're going to post it on the SAA website in the research section on the research page. So it should be there. And then we'll add links and everything for that. And let me ask, I have two more questions really quick. First, let's just land on, again, why it's so important to get the patient input in studies like this before it's widely used. Because I think this is where people who want to participate have the chance to change the trajectory for other people. So
yeah, absolutely. I mean, I think that that's kind of a main reason is that it really helps you articulate, what were things that helped you in your journey that we can kind of translate into strategies for adopting these healthy behaviors. As you said, fatigue can be such an overwhelming burden, and being able to share stories or strategies or things that have helped. Those are things that we kind of bake into the program, and so the patient voice is just so critically important. I can't stress it enough that it's truly a partnership of what can science do? It can only take us so far, because you can find, as you said, with health coaching, you can also find a million apps that can help you manage fatigue, but it may not speak to you in a way that's something that's very tailored for the thing that you have and the people that are doing things that resonate with you. So that's the piece that we're trying to bridge here, and why the patient input is so important.
that's amazing. Well, I'm so excited to spend some time together on this, and I get to contribute. So that's one of the things that helps me get out of bed every day, is just knowing that maybe we made a little bit of a difference for other people. What did I miss anything? What?
I don't think so. I think I do want to express my gratitude for the funding, and to be able to work with people with AXPA is going to be just already so exciting to work with some of the leaders in the field. Truly the people that are invested in the same things that patients want, of just how do we help people live better?
Yeah.
It's just, it's so exhilarating to work on stuff like this. So I just really am fortunate and really appreciate the opportunity to work with this community.
Yeah. And we're so excited to be working with you guys. It's been, it's just an amazing, for me personally, to have watched the way that some of the research done at Michigan has helped me in my own journey. And yeah, without that, there were days, I've told the story before, maybe you didn't hear it. There was a day I interviewed Afton on the podcast, and maybe this is a good place to land, because it was the beginning of the journey that brought us to the funding piece. I'd interviewed Afton I had never really dug into pain. She was getting ready to release her book, The Chronic Pain Reset. And she really hit me. And I was going through just a ton of work related stress, personal stress. And I'd been traveling for kind of weeks on end. And I came home. It was like a Friday night. It was rainy out, and there was a package on my kitchen table, and I opened it, and it was a book. And
Oh,
I just like dug in, and I like read for hours on pain and how pain works. And it's really, that's like a conglomeration, an aggregation of almost all of the pain work at Michigan. And uh, I emailed her that night and I said, I'm going to do this, and then I'm going to have you back and we're going to talk about it. And that was really the beginning. And I kept saying, you do know we give research dollars, right? Like, we're a research organization. And so as we built this, it's just been like, I actually think, to your point, it's this kind of work is the most rewarding work that any of us can do. So I'm personally like really excited and just moved, and also moved by like what trying to contribute can do to change the outcomes for people. And I think those are the people we're looking for, right? And this are the people with AXPA that want to share and help other people with the disease and maybe don't know how today. And you guys are so great about engaging people in the work. And I'm just really thrilled to be part of watching this evolve. So thank you.
yeah, no, it's great. I mean, in talking about Afton's Chronic Pain Reset, like I hate to like be a plugger of books, but I think I've bought that book for probably 5 or 6 people, because I do think that being able to explain how pain works in like a more layperson way, like it's really a skill that I just really think it's such an awesome book, and it's very related to Renew, because Afton also worked on Renew. Like
Yeah.
a lot of the activities, there we have sampled from her from her 30-day challenge too. But it's just a nice way to think about like, oh, like having a lot of symptoms really stinks, but like let's demystify it and figure out how to modify it. What's in your control to modify, and there's a
Yeah.
lot.
Yeah, I will say, I think the book, I told you I'm a total fangirl, right? And the, the content in that book, I think, I mean, it is an aggregation of all the work over years and years and years at Michigan and the various team members. Um, and I too have purchased it multiple times and shared it. And I'll share a tiny piece that I came home one day and it was in my daughter's room, and she read it and started reading it, and said that it gave her like this massive understanding of what how pain works, and she wants to go pre-med, and she actually wrote her essay for Michigan on the book. So it was really interesting.
Wow.
Yeah, she was really like, she just was like, this made me understand myself, and it's a gift. So if anyone needs it, we should link that too.
Yeah.
But
Yeah.
everybody wants it. We want everyone in Renew. So let's do that. Thank you so much for your time. This has been wonderful, and I'm excited, and hopefully we get to have a few more sessions as the study unfolds and share updates with the community.
Yeah, thank you. I really appreciate being able to have some time today to chat about it and about fatigue, and nice to speak to you again.
Yeah,
Thanks for all of your help with this.
thank you.
SpondyCast was made possible by donations from the Spondylitis Association of America's individual members and our show's corporate sponsor, AbbVie. Since our founding in 1983, the Spondylitis Association of America has been the face, voice, and leading nationwide nonprofit educating, empowering, and advocating for people living with spondyloarthritis. Through our extensive work with patients, the medical community, and partners, we provide information and resources to help people impacted by the disease live better lives and champion research to find a cure.